Hello and welcome to the Inside Knowledge podcast for people with IBS. I am Anna Mapson, and today I want to talk to you about how to get a diagnosis of IBS, because you may have had gut symptoms, sensitive tummy, a worry tummy, whatever you call it, for years and years. But if you have never got an official IBS diagnosis from a doctor, then there could be other things that are causing similar symptoms. For those of you where your symptoms have just recently started, this could be a really helpful episode to help you prepare to see your doctor and go to them with some questions and some information so that you get the best out of each consultation, because as we know, time is tight with your doctor, so we want to try and make the most of when you get to speak to them. So today in this episode, which is 115, I'm going to be talking about preparing to see your doctor, what kind of testing you may be able to get on the NHS, and also what alternative diagnoses we want to look out for and screen for as part of the diagnostic process. Firstly, I just want to say I am not a doctor, so I don't diagnose anybody with any condition. As a nutritional therapist or a registered nutritionist, I work with people on an individual basis on their diet and their lifestyle. But normally when people come and see me, they have already been to see a doctor. And if you start working with a nutritionist and you haven't yet seen a doctor, I suggest that you go back and get a medical check, because I'm here to support with diet, with your lifestyle, things that you can change. But we also want to have that process to rule out other conditions. Before I jump into the detail of this week's episode, I just want to remind you that you can get my book on Amazon, and it's called Inside Knowledge for People with IBS and SIBO. And all of this information about how to get a diagnosis, alternative gut health diagnoses, is in the book. You can search for it on Amazon, and it's available as a paperback on Kindle, and it's also on Kindle Unlimited, which means you can read it for free if you have that subscription already. Okay, let's get into today's inside knowledge. So, when we're thinking about why we need an IBS diagnosis, the reason is because irritable bowel syndrome is a collection of symptoms, that make up the syndrome. It will be different in everybody, and this makes it very challenging to diagnose. It makes it challenging to understand as an individual, but also as somebody who is working with people who have this kind of problems. We're really looking at a huge range of individual symptoms that can be completely different. So one person might present with bloating, constipation, feeling very sluggish and tired, food is sitting heavy in their stomach for a long time, don't feel much like eating, pain when they're having a poo on the toilet, and maybe excessive smelly gas. Then somebody else who's also got an IBS diagnosis could feel gurgling and rumbling, have an incredibly loud digestion. Maybe they have 5 to 7 trips to the bathroom every day. It's very loose, watery. They feel like food is going straight through them, and maybe getting a lot of abdominal pain. These really different kind of bowel symptoms, but they're still part of the IBS diagnosis. And I'll look now a little bit about how you get this diagnosis and what you need to do in order to prepare to go and see your doctor. So first of all, if you haven't been to see your doctor about your digestion, here are some things that might be helpful, or on your next appointment, thinking about what you will need to present them with in order to give them the most information about your condition. I do find it really helps to have this written down so that you have got your notes, things that you want to take in, because it's so easy to forget, and you do have such a tight time period. We have less than 10 minutes with the GP. So one of the things they will probably ask you is, how long have you had these symptoms? Do you know what makes them worse? Like, what seems to trigger them? Also, does anything else happen when you have a flare-up? Do you also get other things that flare up? Perhaps you get itchy skin, you get headaches, maybe you have a lot of cramping and pain. And how often do these symptoms occur? At a basic level, that is the kind of thing that your doctor will ask you. Now, you might find it very helpful to go and search for the Bristol stool chart, so you're very familiar with how doctors talk about poo. It can be really embarrassing to have these conversations if it's not something that you're used to having. All right, I talk about this all day long with people talking about how smelly their farts are, what their poo looks like, and you just have to get over it and get used to it. But at first, if this is not a conversation that you have normally, then you need to find the words in order to have these conversations. And the words that we use have been written out in the Bristol stool chart. Bristol is where I'm from as well, quite proudly. So I love the fact that it's the Bristol stool chart because I am here in Bristol. Now, they created 7 specific types of poo, and the reason we need to know that is because it's part of the diagnostic criteria. Your doctor will be asking about this, and so if you can use similar words, it helps them to understand what you're talking about. I've worked with clients who use all kinds of expressions to describe their poos. We talk about rabbit droppings for little hard constipation. We talk about Mr. Whippy, a big load of frothy poo. Pencil poo is another one where they're coming out quite thin. Everyone has their own terminology, and I love that. And it's really helpful when I'm working with someone that I know what terms they're using, but also we need to translate it into the Bristol stool chart. So this is a categorization of various bowel movements from type 1, which is constipated, to type 7, which is diarrhea. If you've never seen this, look it up and see all the different types. It basically describes the form, the consistency, and a little bit about what it looks like. So, for example, type 7, watery, no solid pieces, entirely liquid. Often when people have this kind of diarrhea, it is urgent, can be very hard to keep in. Maybe you've got some accidents or seepage at this point as well. Whereas the other end of the scale, type 1, typically very difficult to pass, hard, lumpy poos, which are very solid and separate. All right, so that's one tool that your doctor will use, and you need to familiarize yourself with that before you go and see them, because it really will help make the conversation a bit easier. All right, anyway, most people I know who've worked with very familiar with that. So let's talk as well about what else they will be asking you. So the way that IBS is diagnosed is using something called the Rome 4 criteria. This is a set of symptom criteria that defines whether you have IBS or another condition. Now, for most people, it doesn't make much difference whether you have IBS or whether you have functional constipation, for example. The symptoms are pretty similar, and for you, it doesn't give you a different treatment plan. That's the key thing, but this is what your doctor will be interested in. All right, so the Rome 4 criteria. What we're looking for is that for the last 3 months, for at least 1 day a week, which is, minimal. For the people who come and work with me are getting symptoms every single day, but let's revisit this. All right, so 1 day a week for the last 3 months, you've had pain relating to pooing. Now, that is the most important part that differentiates IBS from other functional gut issues. So you could have functional constipation if you don't have any pain, but if you have pain alongside the constipation, then it would be classified as IBS. Again, it doesn't make much difference to you as an individual. Right, so what we're looking at is whether you've had a change in the frequency of your poo. So is this something that's happened recently or happened at some point? And you've had a change in the form and the appearance, but really it's about pain is related to defecation process. Right, so also your doctor will be looking to rule out other conditions which present in a similar way. So what they're going to do is ask you some questions about your symptoms, about your lifestyle and things to try and get some clues. And then they may also think about some testing. They may feel your stomach. So they may get you to lie on the bed and prod your stomach in order to feel your belly. And that will be looking for any unusual lumps and bumps. If you have got constipation, maybe they're looking for an impaction, like a bit of stool that is blocking and feeling quite hard. They may order some blood tests to look for sort of inflammation levels, or maybe check your nutrient levels like iron and B12 or your thyroid. And then they could refer you to further tests. Now, similar conditions that I want to talk about, sometimes they're called IBS mimickers because they have almost the same presentation, and the only way we can test for them is to run a blood test or run a stool test. So we can't just guess that people have IBS. Other conditions that you want to make sure have been ruled out as part of your IBS diagnosis include celiac disease. Listen to episode 73 for an overview of celiac disease and IBS, when I talk a lot detail about how to know whether it's worth testing for celiac disease and how to go about it. But in essence, celiac disease is an immune condition where your body reacts to gluten. So even in tiny amounts, your body will create symptoms in the gut, and you may not see all of these all the time, but damage can be done with exposure to gluten in people who've got celiac disease. This can lead over time to long-term damage, shortening of the way your body absorbs nutrients, maybe nutrient deficiencies because of that, and then things like severe fatigue, headaches, as well as the abdominal symptoms such as diarrhea, pain, often weight loss, but not always. And you don't always have diarrhea as well. Sometimes people have constipation and celiac disease. It takes, on average, 13 years to get diagnosed with celiac disease in the UK. And many people are misdiagnosed with IBS at first. And so it's a common thing that gets missed, essentially. So go and listen to that episode if you have not been tested for celiac disease. The way it gets tested is via a blood test, and this will be looking for immune antibodies to gluten, which will only be there if you have celiac disease. If you don't have these antibodies and you have been eating gluten in the run-up to the test, then you don't have celiac disease, which is great. So that is one test that should be done, whether or not you have diarrhea. Even if you have constipation, I think it's really helpful to make sure that they have ruled this out. Another condition that is also frequently missed, and maybe up to a third of people who have diarrhea have bile acid malabsorption. This is where your body is irritated by the presence of bile salts in the large intestine. So this is definitely someone who does have diarrhea. It's quite a complicated testing process. So this is not something that initially would be done straight away. But if you're still getting problems with IBS and you have done a lot of work, again, go and listen to episode 91 where I talk about bile, and also episode 52 where I've talked about IBS-D and bile acid malabsorption. If your doctor thinks that bile acid malabsorption would be something worth looking into, there are various tests that can be run looking at how you reabsorb your bile salts. This is something that I see improve on occasion when people have SIBO, small intestine bacterial overgrowth. Now, this is something else which is not IBS, which is very, very similar and has very similar symptoms. If you're a regular listener to this podcast, you will have heard me talk about SIBO quite a bit. And this is because it's so similar, but also it's not very well understood, I would say, by your GP. Obviously, gastroenterologists know a lot about it, or most of them do. But there is a lot of overlap in terms of what it feels like, and you can't guess that you have it. The way to test for SIBO is to do a breath test, and the moment that is our most reliable route, and that will look for the presence of high levels of gas, so hydrogen or methane, in your breath, and then that gives us an indication of which types of microbes may be living in your small intestine and also where in the small intestine they are. That can then give you a diagnosis, which can then give you a treatment plan. So again, something really important to rule out, to understand whether it's IBS or whether it's SIBO. Another big area that needs to be ruled out as part of your IBS diagnosis is inflammatory bowel disease. So the two main conditions are Crohn's and ulcerative colitis, and these are diagnosed normally by looking for signs of inflammation in the intestines. So whether you have a colonoscopy, or whether we're just looking at blood tests to look for inflammatory markers in the stool or fecal calprotectin. So these are there's a whole range of tests that can be done, but it's, again, really important to know that inflammatory bowel disease has been ruled out because the symptoms are so similar. You have a lot of pain, often diarrhea, excess gas, mucus. These are similar symptoms to people who have IBS. So again, we can't guess, we can't tell from looking at a person whether it's IBS or inflammatory bowel disease. And again, there's a lot of misdiagnosis. I think one study has shown that 10% of people with IBD were first told they have IBS. And a small percentage of those people have had that diagnosis and trying to manage it for a number of years. It can be a bit easy for your doctor to say, I think it's just IBS, unless we've done a test to rule out whether inflammation markers are high. Another type of IBD is microscopic colitis. And sometimes people are misdiagnosed with IBS when they actually have this form of inflammatory bowel disease. Signs of microscopic colitis can be missed because one of the main markers of inflammation, which is calprotectin, and that's an inflammation marker which you often see in the stool, but it can be actually low in microscopic colitis rather than high, as we would expect to see in Crohn's or ulcerative colitis flare. So it's one of the types of IBD which often goes missed, and typically is a lot of pain, again, diarrhea, excessive gas. It's an inflammation in the mucus lining of the gut, and that can really cause very similar symptoms to IBS. The final kind of conditions that should be ruled out when you have got ongoing gut issues include bowel cancer. So although there's no link between IBS causing colon cancer or bowel cancer, we also know that people can be misdiagnosed with IBS when actually they have a cancer. So again, it's really important that this has been checked, normally with a blood test, maybe a colonoscopy. Your doctor will agree whether that is relevant for you. And the other condition to think about is pancreatic exocrine insufficiency, which basically means your pancreas isn't producing enough digestive enzymes, which is leading to fermentation, bloating, gas, and abdominal pains. Now, again, if your pancreas is not creating enough enzymes, I would want to know why. Why is this happening? And it can be lowered in times of stress, high anxiety, stress, ongoing issues like traumas, things that really upset your body. Your body will stop producing these as much, but it could also be a physiological change to the pancreas. So something that is blocking the production or just impairing it. That is not an exhaustive list, but a common set of additional conditions that your doctor would probably be ruling out when you go to them with your gut health issues. So really helpful to have answers to the questions that I mentioned at the beginning, which are around the duration of your symptoms, how frequently they occur, also to rate them, like how severe is this? A really important piece of information for you to give your doctor is, how does this affect you? If it's diarrhea, for example, does this stop you leaving the house? Does it interfere with your work? Maybe it stops you traveling. Tell them how bad it is and how much it affects you. If it's constipation, are you sitting for an hour on the toilet trying to get a poo out every day? This is information that sounds embarrassing to share, but your doctor's heard it all before and will help them to make that diagnosis. Most people, when they come to work with me, have already got a diagnosis of IBS. But if you're out there on your own and you're not quite sure what to do, then the first thing would be to go and see your doctor, try and get this diagnosis sorted so that you are confident you don't have any of these other conditions. And again, just a reminder, the reason is because those conditions can be treated with medication, with special diets, and there is more of a known treatment pathway if you have IBD. There is a set of criteria that you can go through to look at which medication might be more helpful, which diet could be more helpful, and that is typically what your doctor will help you to manage. When you know it's IBS and you have had all of these things ruled out, it doesn't make your day-to-day any easier. It doesn't make your symptoms any less, but it allows you to feel confident that it's diet and lifestyle are going to be the things that you can do that you're in control of to help you. So if you want some help with your gut, please do get in touch. I work with people over 3 months in my gut reset, and it's an online program. So I help people all over the world, wherever you are, no matter what kind of IBS you have, I can help you. Or if you have SIBO, that's small intestine bacterial overgrowth, that is another condition that I work with. And if you're not quite sure, I can normally help you to get the testing for SIBO, especially if you're in the UK, but I can also recommend providers of the test in the US. Okay, I'm going to leave it there for this week. If you have any questions about IBS and digestion, or you want me to investigate anything and try to talk through a topic in my podcast in future episodes, then please email me. It's info@goodnessme-nutrition.com, and I will have a look through the suggestions. Thank you very much for listening to this episode of the Inside Knowledge podcast. Better digestion for everyone.